you're an athlete at Lafayette College, probably there are good chances you're going to be injured. And if you are injured, you'll see Dr. Jeff Goldstein, and that's who Mike has as his halftime guest.
Well, thank you, Gary. And the string of VIPs doesn't end. I'm joined by Dr. Jeff Goldstein. Dr. Jeff, welcome to the program.
Thanks for having me.
Dr. Jeff, you came here in 2001 and became a big part of the Lafayette community. Just tell me a little bit about maybe what brought you to Lafayette's campus and what really attracted you.
It's interesting, back this is 16 years ago, I really wasn't looking at college health at all, and a good friend of mine, ex-colleague Pam Brewer, we were at a party together, and she said, Jeff, you gotta check out this great job at Lafayette. I was really in the middle of a career in emergency medicine, and I said, Pam, I'll look at it, but quite honestly, I'm an emergency room doc, and next thing I know, I'm on campus taking a look around, and I said, this is really cool. And one thing led to another. They did a series of interviews, and here I am. It's been a fantastic journey.
We've had a great string of team doctors here and team physicians and community physicians, and Dr. Stein was here when I was here, and then Dr. Alan Johnson, obviously. So you're following in a long lineage there. And just tell me a little bit about maybe what about the school has been so effective here, because we have there's not many peer institutions that have a full-time employee to take care of the community and then obviously to be the team physician.
Yeah, we're super fortunate here, and we have these tremendous relationships going on between the health center, sports medicine, and coordinated health, which really creates this tremendous team that, to be quite honest, so many of our peer institutions in the Patriot League, especially the folks in sports medicine, are quite envious, because those types of relationships that we have between the health center, sports medicine, and coordinated health make for just a phenomenal team and really, provide amazing care for our student athletes. There's really not a day that goes by that I'm not on the phone with Matt or one of his trainers, and they feel very comfortable calling me on the cell phone day or night, asking me about an athlete, and it's just it's a awesome relationship, and it really it's really even better in that I can pick up the phone any time of the day or night and talk to one of my colleagues at Coordinated Health. We were so fortunate over the years to have Carl Weiss, who was just a phenomenal orthopedist and team surgeon, and he would not give up the reins until he found someone like Nick Slenker, who is also really an all-star. And we're just so fortunate to have that kind of relationship, because when a student athlete goes down and we need to get things done and we need to get it done fast, that relationship with Coordinated Health is just phenomenal.
Dr. Weiss has been fantastic. I know him personally because he did my knee and my elbow, and he is just a wonderful guy. Does that give us any type of a recruiting advantage? I would think it would, because a recruit comes in here and the parents drop them off. They're turning them over to a coach for 4 years, and they're entrusting basically their son or daughter with you guys and with the staff. That's got to be some sort of a recruiting advantage for Lafayette.
Yeah, I think it helps a lot, and a lot of the student athletes, when they're taking a look at this institution, they do get to meet me. Frank often invites me to his banquet dinners to listen to his bad jokes, and I often get to meet all the student athletes that come through, and they can see the kind of relationships that we have with sports medicine, with coordinated health, and I think it really does help with recruiting.
Well, we are so happy to have you with us. Thank you for a couple of minutes. I really appreciate it.
You're welcome.
Dr. Goldstein right here, and again, Lafayette just does it with the best in the class. Back to you.